Yesterday we began the topic about lymphatic system immunity. So basics of lymph, lymph vessels, what are lymph nodes and lymph nodules are discussed yesterday. Today we will discuss about lymphatic tissue, that is spleen, okay, and as well as thymus, okay. And we already discussed that what is the difference between lymph nodules and lymph nodes, okay. So like tonsils and in the nodules are present in the mucous membrane, okay, like digestive system, urinary system, respiratory system, everything, okay. So now we will talk about spleen. So spleen is located in the upper left quadrant of the abdominal cavity, just below the diaphragm, behind the stomach. The lower rib cage protects the spleen from physical trauma. So you can see the location of the spleen. I think it's not given here. So basically, if you feel the ribs, okay, lower end of the lips. So this is the location of lower end of the lip at left side. Okay, you can feel the ribs are ending. So the ending area is there is a spleen. Okay, I think diagram is given or not. You can see that. So upper, this is the upper chest cavity, and you have diaphragm here, and ribs are ending here like that. Okay, rib cage. This is the rib cage. Okay, so this is here we have the abdomen. Okay, here we have the spleen. Okay, so this is the spleen in the left upper quadrant. So we will divide our abdomen into four parts: right side and left side. So this is the left side, and upper quadrant, lower quadrant, upper quadrant and lower quadrant, right upper quadrant, right lower quadrant, left upper quadrant and left lower quadrant. So in the upper quadrant, we have spleen, stomach, pancreas, and some sort of uh, small intestine and large intestine. Okay, likewise, here we have the urinary bladder, we have urethra also. Okay, and in the pelvic region, the female have uterus, vagina, everything. Okay, so we have concerned with spleen. So this is the spleen. In the fetus, the spleen produces red blood cells, a function assumed by the red bone marrow after birth. After birth, the spleen is very much like large lymph node, except that its function affects the blood that flows through it rather than lymph. So basically here, uh, in the fetus, when the baby is in the mother womb, so the red blood cells, who produce red blood cells? Now the red blood cells are produced by red bone marrow. But in the fetus, the blood is produced by spleen. Okay. So uh, after birth, the function transfer from spleen to a red bone marrow. Now spleen is a lymph organ, large lymph nodule or organ, node. Okay. So basically here, the lymph is flow from the spleen. So what are the functions of uh, lymph, this organ, spleen organ, after birth? What is the function? Contains plasma cells. Yesterday we discussed plasma cells, that macrophages. Okay, the first defense is macrophages. Uh, if the biotics are bacteria is higher than macrophages, so body will plan, lymphocytes will plan to produce an antibodies. So they will tell to plasma cells. Plasma cells produce antibodies. Okay, for killing bacteria or any pathogen. Okay, who produce? It is present. Plasma cells is present in the spleen. Okay, contain fixed macrophages. Also, macrophages that phagocytic pathogens or other foreign material in the blood. The macrophages of the spleen also phagocyte old red blood cells and form bilirubin by way of portal circulation. The bilirubin is sent to the liver for excretion in bile. So here the second process is macrophages. Second cells are contained in the spleen are macrophages. They have to kill the any pathogen which contain in the blood. So our own red blood cells, when they damage, when they die, so here macrophages will eat and they will release the bilirubin. Bilirubin will send to the liver and it will excrete by the bile. Okay, through the feces. Okay, so here second thing we have to know about it. And third thing, store platelets and destroys them when they are no longer useful. So extra amount of platelets or the platelets which are not working, they are just wandering in the blood. So what will it will do? It will collect them, store them, and it will see if there any functioning is happening or not with them. If the functioning is happening, what will they do? They will release the platelets. If the functioning is not happening, so what will spleen do? It will destroy the platelets. What will it will do? It will destroy the platelets. The spleen is not considered a vital organ because other organs compensate for its function. If the spleen must be removed, the liver and red bone marrow will remove old red blood cells and platelets from circulation. The many lymph nodes and nodules will phagocytic pathogens, as will the liver and have lymphocytes to be activated in plasma cells to produce antibodies. Despite this redundancy, a person without a spleen is somewhat more susceptible to certain bacterial infections such as pneumonia and meningitis. So basically here they are not giving much importance to the spleen because if the spleen is not, then assume if there is no spleen in the body, so there are the multiple other organs which will work like spleen, like our liver, like our red bone marrow, okay, and other cells have also phagocytic action and plasma cells. Basically, they will work, but they cannot work like spleen. And you know the importance of spleen. This is very very important according to me. It is the basic of immune system. If spleen is not there, if spleen is not functioning properly, you mean your immunity is always in low side. So to boost immunity, we work on spleen. And other thing that other than uh, modern medicine, if you go to the acupuncture, we have very important the spleen because spleen which produce the energy, chi, it digests the food, it convert the uh, uh, it convert the chi from the blood. Okay, whatever food chi, food chi into blood chi. Okay, so this is the main function of the spleen. So if the spleen is not working properly, so there are number of multiple disorders will happen. Likewise, here also given, if a person without spleen, what will happen? The bacteria will attack very fastly. So nowadays, the viral infections are happening, bacterial infections are happening. No one is focusing to work on spleen. They are only giving antiviral, antifungal, everything they will give. They will kill the bacteria, but they cannot give the protection to the body. You have to, if you want to protection, you need immunity. So immunity will get from the spleen only. So you have to work on spleen. So we have, so that's the reason in the acupuncture it will give many importance in other systems also like electrohomeopathy. The we give much importance to the spleen because we have system. Lymphatic system and circulatory system is very important because lymphatic temperament people immunity is low. Okay, similar temperament. whose immunity is higher than lymphatic temperament. So lymph organs are activated in the lymphatic temperament. So we'll discuss in electrohomeopathy. But here I'm explaining about how the immunity is important to the body. So in the electrohomeopathy, we give the importance to the lymphatic system, immune system. In the acupuncture also, spleen have much important. So basically, why we give important? Because of its defense mechanism. It produce antibodies. It's protect. It will purify the platelets. It purify the blood. It kill the waste products which are in within the body. There are number of waste products we cannot use. Likewise, if you I give an example that if you have mobile phone, you have a number of photos, images, contact numbers, okay, videos, music, everything you have, but you cannot use all those every day. Okay, what will happen? They will get into the some storage space. They will act as uh, for becoming so slow processes to the phone. So likewise in our body also there are number of cells, number of millions, billions of cells. So they do not work regularly. What will happen? They are just like falling down. Okay. So what will happen? We have to wake up them. We have to give strength them. We have to stimulate them. So the work is given done by spleen. Okay. So next come to the thymus. Okay. Thymus is located inferior to the thyroid gland in the fetus. So let's see the mm, here is the location of the thymus. Here not given. Why I don't know. Okay. Let's see in the so you can see this is the best very good image. This is the thymus gland. So it is above or beneath the windpipe. Okay. Here is the thymus which is attached here. This thyroid gland take yeah. This is the vena cava, superior vena cava, and aorta. Okay, this is the heart. So this is the lungs. So this is attached to the upper lobe of the uh, lungs. Okay. So let's talk about thymus. Thymus is located inferior to the thyroid gland. In the fetus and infant, the thymus is large and extended on the sternum. With increasing age, the thymus shrinks and relatively little thymus tissue is found in adults, although it is still active. So basically, at the beginning of the uh, childhood, so we have large thymus. The size is also very good. Okay, as age increases, what will happen? The area, the width, the length of the thymus decreases. But still, there is a small amount size of thymus is present in adult. Okay, so you can see that this is the lymphatic system. Sorry, this is the lymph node. In that we have like this capsule is there. We have arteries, veins, and one is lymphatic system. Okay, so this is the capsule. This is the afferent lymphatic vessel which brings the lymph. This is the efferent lymphatic vessel. This is which takes away the lymph. This is the cortex area. This is the capsule. Okay, this is the nodal vein, nodal artery. This is the hilus. This is everything is there, na? So we'll call hilus. In that, if you see one part of cortex, you can see lymphocytes. These are the lymphocytes. Okay, neutrophil, plasma cell, macrophages, and antibody molecule, antigen. Okay, everything is defined. The stem cell of thymus produce T lymphocytes. Okay, the stem cell, the main cell of thymus, what it produce T lymphocytes or T cells. Their functions are discussed in the next section. We will discuss about T lymphocytes. Okay, their functions. Thymic hormones are necessary for what may be called immunological competence. To be competent means to be able to do something well. So thymic hormone, why would necessary? Because we want to uh, defense against the we want to protect our body from against bacteria. First thing, one is protection, one is fighting. So for both things, we need thymic hormone. Okay, they will recognize, they will kill the bacteria. Okay, the thymic hormones, what they will do? The T cells to participate in the recognizing of foreign antibodies to provide immunity. So what will T cells do? T cells do go. They will go in the blood and they will collect. They will see, and is there uh, any antigen is there, foreign body is there, pathogen is there. But then according to that, they will develop the immunity. This capability of T cell is established early in life and then is perpetuated by the lymphocyte themselves. So gradually, the immune system develops in the body. Okay, in the beginning of the birth, what will happen? There is the immunity is very low. And gradually, the immunity develops in the baby. Okay, so the newborn's immune system is not yet fully mature, and infants are more susceptible to certain infection than their older children and adults. Usually, by the age of 2 years, the immune system matures and becomes fully functional. So here, uh, I give example. I will give the example. During the 0 to 1 year age, the baby gets cold, cough, lose motions, and have fever continuously from 2 to 3 months, 4 months, 6 months, 8 months, 10 months, okay, 12 months, 16 months, 18 months. Why this happening? Because the immunity is developing in the body. The lymphocyte doesn't know about the bacteria. They are reacting first time to this external environment. So what will happen? The immunity is developing. They are preparing the antibodies. So second time the same infection will come. The baby doesn't have fever. Okay. So this is the reason. So infants or babies have initially they have problem with the health conditions. This is why some vaccines such as measles vaccine are not recommended for infants younger than 15 to 18 months of age. Their immune systems are not mature enough to respond strongly to the vaccine, and the protection provided by the vaccine may be incomplete. So basically, number of vaccines are recommended after 2 years age because their immunity is not developed completely. So here next is immunity. So we'll discuss immunity. Before that, we have one condition that is Hodgkin's disease. Hodgkin disease is a malignant disorder of the lymph. So what is it? Malignant means cancer. Cancer of the cause is not known. The first symptom is usually swallowed, but painless lymph nodes. So lymph nodes are swallowed. Wherever lymph nodes are present, cervical, axilla. Okay. So those lymph nodes are swallowed, but there is no pain. Often in the cervical region, I told you, cervical region. The individual is promoted to seek medical attention because of other symptoms. So, other than that, what symptoms are seen? Chronic fever, fatigue, weight loss. Okay, so yeah, the patient is unable to walk, stand, and he or she have weight loss. All this is seen in this disease. The diagnosis, how we do, we will do biopsy. But biopsy now allopathy doctors recommended to do biopsy. So, okay. A treatment of Hodgkin disease requires chemotherapy. Here the radiation, chemotherapy, So sometimes it is often curable, sometimes it is not curable. So I tell you, one patient, he had always neck pain, swallowing, cervical lymph nodes. I have one patient, 1.5 year back, I think so. So he had for past 3 to 5 years, he will go to the clinic, he will share the symptoms to the doctor, and he will advise antibiotics. He take the antibiotic. He will have relief from 3 to 5 days. Then he doesn't have 2 to 3 months. He will have no issue with that lymph nodes. But after 2 to 3 months again. So likewise, he is doing from past 5 years. Okay. So he came to my clinic with my friends. Uh, his relatives are close to my. Okay, so he came and he after that I saw him, and after the lymph nodes have swollen here, less pain, but he have fever. And every time mm, uh, whenever he get swallowing lymph nodes, he had fever, no pain. So after that, I think that he is having some problem issues, and his immunity is low, and he may going to the Hodgkin disease. So I advise to take the proper treatment to him. I counsel them. Okay. So after that, they took the treatment for two courses they done. So I think till now, 1.5 year happened, no complaint from that person. So I gave the electrohomeopathy treatment, not other treatment than that. So initially I gave two things. So to increase the immunity booster, we have electrohomeopathy treatment. L1, L1, S1 will work wonderful. L1, S1, and we have RE also, B, E, G. So every according to the condition, we have to add electricities. So basically, it will give wonderful results to me. And till now, there is no problem to him. Okay. So basically, we work with electrohomeopathy for this kind of patients who suffer from uh, lymphatic system problem or lymph node problem, any problem. Okay. Now we'll start immunity. So basically, immunity is a very big chapter here from that. So and we have to understood very clearly because immunity is a base of any system. Because immunity is the reason the back the any pathogen is entering. If the immunity is good, the patient is good. If the immunity is bad, the patient is bad. Okay. So now we'll discuss all these things in detail here. Okay. So what are the subtopics? Let's see that in the immunity, what are going to study. So basically immunity have some types, innate immunity and okay. First is innate immunity. In that we have detail. Okay. Next is adaptive immunity, second type. Next is cell mediate. In the adaptive immunity also we have types. This is the two topics and we have subtopics, different subtopics. Next is types of other immunity. Okay, like genetic immunity, everything, acquired immunity. Next is lymphatic system aging. So we have about immunity types we are going to discuss, and in that types, which immunity works, which type. So okay, so let's start the immunity. About immunity, what is immunity? Immunity may be defined as the ability to destroy pathogen or other foreign material and to prevent further cases of certain infectious disease. So here simple definition is given. Immunity is the ability to destroy the pathogens. First is I think two things you have to remember about immunity. First is defensing, second is attack. If the defense mechanism is good, you doesn't need to destroy the pathogen. Defense mechanism is good, pathogen unable to enter into the body. Destroy mechanism is good. After entering of the pathogen, the destroy mechanism will destroy the pathogen. So we want both of them to very good, very strong to develop good immunity. We need both of them, defense mechanism and as well as protection mechanism or destroy mechanism. Okay. So this ability of vital importance because of the body is exposed to pathogen further from the moment of birth. Because here allopathy doctors always allopathy or modern medicine think that in the environment, external environment, there are lot of pathogens, billions of pathogens, which will destroying our body. To protect the body from the pathogen, we need immunity. If the immunity is not good, we will destroy the pathogen directly by giving antibiotics. This is their theory. Antigens are chemical markers that identify cells. Human cells have their own antigens. They identify all the cells in the individual as self. When antigens are foreign or non-self, they may be recognized as a destroyed. Bacteria, virus, fungi, and protozoa all are foreign antigens that activate immune response or as are cell products and such as bacterial toxins. So basically, we have antigens. Antigens are all body organs. Uh, they have to identify. Okay, so lungs to identify heart, heart to identify lungs. So they have antigens. Uh, both are unable to see themselves. With the help of antigens also, the chemical marker, they are identifying this is the lungs. Okay, you are the lung. Lungs will understand this is the heart. Okay, you are the heart. So likewise, they talk to each other with the help of chemical markers or antigens. So our body have own antigens for talking one organ from other organ. But if the same antigen is coming from outside environment, what will happen? Our own body will not able to understand who is that, who is that, who is coming in the body. So let's attack on them. So if the antigen is coming from the outside, what will happen? It will remove some toxic substance. Bacteria is remove some his material into our body. That is toxic material. Okay, so what will happen? Our immunity activate, our immunity will generate some kind of energy to destroy that bacteria. Okay, this is the immunity. Malignant cells which may be formed within the body as a result of mutation of normal cells are also recognized as foreign and are usually destroyed before they can establish themselves and cause cancer. Unfortunately, organ transplant are also foreign issue and the immune system may reject a transplanted kidney or heart. Sometimes the immune system mistaken reacts to part of the body itself and causes an autoimmune disease. Several of these were mentioned in previous chapter. Most often, however, the body immune mechanism function to protect the body from the microorganisms. Basically, immune system will recognize the body with the help of chemical markers. So if you want to take the body organ outside and you want to transplant one kidney from other person, so other person's antigen, the heart and the lungs, they cannot talk to each other because the antigens are different. Now the body assume that this organ is foreign material, so you have to kill that organ. You have to destroy that organ. So likewise, transplantation sometimes fails nowadays. Autoimmune disorder tablets are came which work on immune system to stop the development of uh, further destroying. Okay, immunity has two components: innate immunity and adaptive. Immune immunity may be called non-specific, does not create memory, and its response are always the same regardless of the target. Adaptive immunity is very specific to the target, may involve antibiotics, but does create memory and may become more efficient. Both kind of immunity work together to prevent damage and tissue. So here two types of immunity is given. One is innate immunity and adaptive. Innate immunity is not specific. So whenever bacteria will come, they will recognize as a newcomer. Okay, that doesn't memorize, that doesn't maintain a specific amount of specific amount of defense mechanism. So always they treat as first time. First time they defeated them, second time they defeated, third time they defeated. So likewise, they are defeating the other person, other pathogen. So, but second is adaptive immunity. Adaptive immunity is after entering of pathogen is if innate immunity fails, the pathogen enters into the body. So adaptive immunity activates. It will make specific antigen. So if the first time the infection enter into the body, so the adaptive immunity recognize that and it will have already prepared that antigen was antibodies, sorry. So antigen already prepared, so it will tell the antibodies, please go and kill the bastard, kill the pathogen. Okay, so this is the second type of immunity, adaptive immunity. Innate immunity and adaptive immunity. So first fever came, what will happen? Innate immunity activated, so the fever is not subsided, always increasing. So what will body do? Body will activate adaptive immunity. So that the adaptive immunity produce antibodies and it will kill the pathogens which are responsible for the fever. Okay, so this is the importance of immunity and innate immunity and adaptive immunity. So in the innate immunity, we have barriers which will protect, and defensive cells protection, defensing we have different types like chemical defense. Okay, and natural natural killers. Okay, and inflammation, complement, all these are due to the defense cells. Okay, next we have a adaptive immunity. Okay, so we'll talk about this later in coming class. Okay, if anyone have any doubt, can ask.